Hello friends, let's continue in ophthalmology high yield points. So corneal epithelium, this is stratified non-keratinizing epithelial cells. Next one, Bowman's membrane and stroma, they do not regenerate. So Bowman's membrane and stroma do not regenerate. Next one, Duas layer. It is newly discovered and it is the toughest layer. Even though from descimate membrane. So descimate membranes was considered as toughest, but now Duas layer is considered toughest layer. Next one, descimate membrane. It has ability to regenerate. Endothelium cells, it has sodium potassium ATPase. That's why it is in dehydration state. तो सोडियम पोटेशियम ATPase के कारण endothelium cells dehydrate condition में रहती है. And it so maintain transparency. Its function is to maintain in transparency. Next one, transparency of cornea. So there are some theories. One is the Morris theory. It says there is a regular arrangement of corneal lamellae. Second one is peculiar refractive index of corneal lamellae. It is the Goldman theory. So refractive index के बारे में बात करेगा, that is Goldman theory. And arrangement, Morrissey theory. Okay, there is avascularity condition, so no vessel in cornea, and there is balance between IOP and swelling pressure. Next one, density of corneal endothelial cells. It is calculated by this specular microscope, and so normal density is 2500 to 3000 cells per square mm. Next one, microcornea किसे बोलेंगे? So microcornea, the horizontal corneal diameter 10 mm or less over 2 year of age. Okay, so over 2 year of age 10 mm or less microcornea बोलेंगे. And in a newborn, if it is less than 9 mm in newborn, this is microcornea. Okay, now megalocornea. Diameter is 12 mm or more up to 2 years, or 13 mm or more if age is more than 2 years. 2 साल तक अगर 12 mm है, that is megalocornea. 12 mm या more 2 साल तक, then it is megalocornea. If 13 mm or more, if large, if age is more than 2 years, megalocornea. बड़ी आँखें, X-linked recessive, and male is male more than female. So megalocornea, X-linked recessive. megalocornea किस में ज़्यादा दिखती है? Male. Next one, gonococcus can invade cornea. So let's see a few organisms that can invade cornea. We can remember by CH and LS channels. Corynebacterium diphtheriae, H. influenza, this Neisseria gonorrhea, Listeria, and Shigella. So your 5 organisms they can invade cornea. Next one, what we see here is the serpentinous fashion ulcer. Serpentinous fashion ulcer at the center of cornea. This is gray, white, yellow disc shaped ulcer. So serpentinous ulcer is with a Hypopine corneal ulcer, that is pneumococcus. Pneumo मतलब ऐसे ही ऐसे गोल गोल gauss surgical non-surgical ocular trauma. So how it can happen? Pneumococcus is causing serpiginous fashion ulcer due to surgical or non-surgical ocular trauma. Next one, so we see improper contact lens uses. रात को आँख में या contact lens लगा के सो गया. So this causes pseudomonas infection. So improper uses of lens. Patient slept with contact lens overnight. So that is predisposing factor for pseudomonas infection. What is pseudomonas? gram-negative bacteria, and it causes corneal ulcer. It is contact lens associated keratitis. It can perforate within 48 hours. Okay, next one. Concentration of fortified cefazolin eye drop is a uncomplicated, or in case of uncomplicated keratitis, is 5%. So 5% is still very high. So cefazolin eye drop in case of uncomplicated bacterial keratitis is 5%. Next one, what is this? Hypopine is seen here. Okay, and this is fungal keratitis. This is non-sterile hypopine, non-sterile. So most common fungal infection causing fungal keratitis is aspergillus. It's causing pigmented ulcer, fixed, non-sterile, and filamentous is seen here. It is fixed. आँखें हिलाने डुलाने से हिलता नहीं है यह. Fungal keratitis hypopine is F, means fixed. Fungal keratitis hypopine, if present, fixed. So fungus can penetrate anterior chamber without perforation. अंदर तो घुस गया लेकिन फोड़ नहीं दिया है. Okay. Next one. Immune ring of Vasili. Immune ring of Vasili कहाँ दिखती है? Fungal corneal ulcer. It is type 3 hypersensitivity. So remember, type 4 नहीं बोलना है, type 3 hypersensitivity. Antigen antibody complex. Antigen antibody complex depositions. Okay. Type 3 hypersensitivity. Next one, hypopine in fungal corneal ulcer. Hypopine, it may be present, it may not be present, but satellite lesion is present. Okay, immune ring of Vasili is present. There is a dry sloughing and immobile hypopine. Again, fungal is F, fungal corneal ulcer. So hypopine present, then it will be fixed. Bacterial में move करता है. And there is the direct invasion to anterior chamber. Direct invasion to interior chamber. Next one. If we see filamentous fungal keratitis, filamentous fungal keratitis, so what are the causes? Aspergillus and fusarium. So netamycin 5% is a choice. So yeast infection, just like amphotericin, like candida. Yeast infection, just like candida, amphotericin B is the choice. But filamentous fungal keratitis, netamycin 5% is the choice. Filamentous fungal में क्या आएगा? Aspergillus and fusarium. Next one. So we see this herpes simplex virus causing dendritic ulcer. So dendritic ulcer is a feature in primary herpes or recurrent herpes. So herpes herpetic infection can be primary or recurrent type. Both of them can have dendritic ulcer. Here the corneal sensation is lost. और कौन से कॉज है जिसमें कॉर्नियल सेंसेशन कम हो जाते हैं? यहाँ तो लॉस्ट है, टोटली लॉस्ट. जहाँ कम होते हैं लेप्रोसी एंड डायबिटीज मिलेटस में कम हो जाते हैं. बट कॉर्नियल sensation is lost in herpes simplex virus dendritic ulcer. ओके herpes कहाँ कहाँ हम सोचेंगे? geographical ulcer, but this is in a recurrent type. Punctate epithelial keratitis, this is also in a recurrent type herpes. Sorry. एक दूसरा है corneal guttae. Corneal guttae is not seen in herpetic keratitis. This is corneal dystrophy. Next one. This is Hutchinson sign. So what is Hutchinson rule? अगर शक्ल पे इस प्रकार से herpetic zoster अगर उग आया है means reactivation, तो क्या होगा? herpes zoster ophthalmicus होगा. Okay, so reactivation of varicella zoster virus is causing varicella zoster virus reactivation is causing what? Herpes zoster ophthalmicus. But if it involves tip of nose, then there is very high chance of risk for developing ocular problem involvements through nasociliary nerve. अगर यह sign हो जाए, then this is Hutchinson sign. So we see here again geographical or dendritic ulcer. Next one. Herpes zoster ophthalmicus treatment choice is what? Systemic is cyclovir. It is what ये कौन सी condition है? Reactivation of herpes zoster virus, and it may cause neurotropic keratitis. Next one. So we see this ring, this whitish ring. Okay, this is patient has contact lens history. This is what? Ring lesions, stromal infiltrate, ring lesion of stromal infiltrate. It is contact lens induced. So क्या हो सकती है? acanthamoeba keratitis. Okay, here perineuronal invasion is seen. That's why दर्द बहुत ज़्यादा और फाइंडिंग बहुत कम, ऐसा हो सकता है. पेन disproportionate to degree of keratitis. So treatment is PHMB, that is polyhexamethyl biguanide. Okay, next one. The cause of interstitial keratitis is tuberculosis, HSV and malaria. और भी कई सारे हो सकते हैं, but interstitial keratitis I कैसे याद रखेंगे? interstitial keratitis I अंदरूनी बातें हैं. So their epithelium and endothelium are okay. But there it involves stroma. It is non-ulcerating and inflammatory reaction. It causes stromal vascularization. Stroma में vessels आ जाते हैं. So that's why decrease vision. So next one, what is this? Salmon patch cornea. This is seen in syphilitic infiltration. So we can see deep vascularization of cornea, radial bundle of brush-like vessel. Okay. Syphilitic congenital syphilitic corneal involvement, interstitial keratitis. If it is causing interstitial keratitis, syphilis interstitial keratitis कर सकती है. So it can have the three stages: progressive stage, florid stage, and regression. Progressive stage is ground glass appearance, florid stage is salmon patch, and regression is ghost vessel होते हैं. Next one, limbal stem cell marker. Limbal stem cell marker full रट्टा है ABCG2, nuclear protein P63, alpha enolate. Okay, and next and last one, this one, bacterial corneal ulcer with hypopine. तो हाइपोपायन क्या होगा? दिस इज बैक्टीरियल. तो ल्यूकोसाइट वेसल से लीक करके नीचे जम गया है. ल्यूकोसाइट्स एट बॉटम ऑफ एंटीरियर चैम्बर इज सीन. दिस इज लुकिंग लाइक वाइट. इट इज स्टेराइल. क्यों? कंटेंट्स ल्यूकोसाइट्स. न्यूट्रोफिल की बात नहीं हो रही है. एंड दिस इज मोबाइल, फंगल में फिक्स्ड होती है. ओके, सो फ्रेंड्स, प्लीज like and subscribe my channel. Thank you.